Hi guys, my name is Rhonda Ayala, and I was diagnosed with a pancreatic neuroendocrine, which is called PNET. I don't know how many of you have heard of that. And what they do with the PNET, this is in 2010, I was diagnosed, is they give a surgery called a Whipple. And have any of you heard of a Whipple before? Okay. You haven't. Anyway, I had a Whipple in January 28th of 2010. And after my surgery, I was told that I was cured because all the lymph nodes were negative, all the tissue surrounding it was negative, they had all the margins were complete, and there was nothing left of my neuroendocrine tumor. So I went to, I was at University of Miami, and the head of the pancreatic department there came in and had a big smile on his face and waved my papers, and he said, "Congratulations, you just won the Life Lotto." And I was so happy and celebrating, like, hey, that's over, I never have to deal with that again. And so I went to a local oncologist and was followed up with him for about a year. He did CAT scans and whatnot every 3 months for a year. And then at the year point, he looked at me and he said, I think I need to tell you that you're 99% sure that you are 100% cured and that you don't need to be followed anymore." And so I was a little nervous and asked him for like a mental health MRI, because you know how you don't want them to let you go. And he denied that. He said no. And right around that time, I started a group called the Whipple Warriors. And now we are in over 30 countries in every state in the United States, and there are 6,000 Whipple patients from around the world who've all collected together. So one of the things I did with the Whipple Warriors is I was trying to find different groups to come in, and patients who needed the Whipple, let's all talk about it. So I made this call to this one group called NCAN, and I got a hold of some woman named Mary Ann, and that changed my life. And so she saved my life because I was told I was fine, I was cured, etc. And I got speaking with her, and she said, "No, you still need to get some, blood work and whatever going." Well, that prompted me to find a new oncologist. And I found a new oncologist, and without Mary Ann, I wouldn't be here, because 4.5 years later, I got, the CGA came back and it was 140. So it had metastasized to my liver 4.5 years later. And so without Mary Ann, obviously my liver would have been done. At any rate, where am I in my story? Okay. So I ended up having to have, where mine occurred, reoccurrence was right where the Whipple was, where they had taken out, the bile duct, and they just do this big replumbing in there, and mine grew back right in that area. So I was declared like non-surgical, and I ended up finding a physician who actually would do the CyberKnife procedure on me. So I had the CyberKnife. I don't know, you can ask your doctors how standard that is or whatever, but I ended up getting CyberKnife for a tumor that I was not a surgical candidate, and that was by like 3 or 4 different specialists around the country. So the CyberKnife decreased it and killed my non-surgical tumor, and I was good for a little while. And they also put me on heavy, what was it called? Carboplatin and etoposide. So they hit me with cisplatin or carboplatin, one of them. And so they hit me with heavy IV chemo at that point, because that tumor was growing really fast. And although the first one I was diagnosed with came back with a KI of 1, this one had 25. So it came back as a different type. It was a gastronoma, and it had higher grade. So the doctors, my doctor consulted with some specialists around the country, and I was put on these 2 heavy IV chemo agents, lost my hair, etc. Then I was good for another year or so, and 2 Octobers ago, I had a scan, and they found 6 little mets in there. And so they put me on the Captem that is now being studied, that combination. And after 3 rounds of it is usually when you get an MRI. And my doctor was a little bit chicken, which I'm grateful for. But he did it. He took an MRI and redid my testing after only 2 rounds. And 4 of the 6 were already gone. So fast forward till now, I don't have any active disease for 18 months now, about 18 months now, no active disease. Yeah, I'm still on Capten. I do it 2 weeks out of every month, and you take the capecitabine, which is called Xeloda. Every 2 weeks I take 2 pills in the morning and at night, but the last 5 days of the 2 weeks, I added in the Temodar the last 5 days, so I take both of them for the last 5 days. And I've been doing pretty good. I mean, the only side effects I'm having from that personally is a thing called hand and foot, which is dry skin of the hand and feet, but you just keep moisturizing. I have dry eyes, but you know what? I'm here, so I don't care. And that's my story.
My name is Judy Galtz. I'm from New Jersey, and my story is very similar to Marianne's in as far as the history goes. I wound up with a tumor in my terminal ileum with mets to the lymph nodes. I was similar, bleeding. I had rectal bleeding a couple of times before I was diagnosed. I was told many other things except carcinoid. And I had already been a nurse like 20 years, and when I was finally diagnosed and they found it on exploratory, I had never heard of it before. So I, got the good news and the bad news. And the good news, they found something. I wasn't crazy, and there was a reason for all this. But the bad news was, what the hell is carcinoid? And in 2001, when Marianne and I was diagnosed, there was not a lot of information out there, and it's very similar. Anything I found looked like I was not going to be here in 5 or 6 years. And when I found out it was a slow-growing disease, I was like, oh hell no! If it's slow-growing, we're going to catch it, or we're going to rope it in, or something. There's got to be something to be done. So, for those that are newly diagnosed, I just want to say a couple of things. One is, I'm sorry that you got diagnosed with this, but the timing is so much better than for those of us that were diagnosed years ago, because there's so much. And a lot of that is because of the Waymans and everything that they have done and accomplished all these years. I've been very fortunate to know them from the beginning, when we were just kind of fledgling around with support groups and trying to figure out what to do. And I want you to really be able to appreciate everything that they have done. I mean, they, went from like a small group in New York to reaching, really across the world, and have just brought this community together, and not only with patient to patient, but educating medical staff and providing information. And it's, there's not a section of this disease, whether it be, from patient or medical, or just even dealing with the drug companies, that they haven't touched and had an influence on. So I really, it's very important that we continue this support, because this really, there's other groups out there that, deal with carcinoid and neuroendocrine, and we should support them all. But this is really a group that has really, and is just really moving very quickly with this. So I'm very proud to be part of this, and I'm proud that I've been friends with them for a very long time, and not getting paid to say this, but I really think that, the fact that you guys are here shows that you really have that drive to find out more about yourself or your loved one that you're here for, and that's very important. And that's what we were talking about before with advocacy, because we all are drops in that bucket. And if it's something as simple as providing information to some study, or sending in tissue, little things that you can do that don't take any of your time or effort to do is very, very important.
I think also what a lot of you need to know too is that in your bags are ribbons, there are little pins. There's bracelets. Wear your bracelets, wear your pins, because you never know if somebody's going to look at it and say, "Oh, what is that?" Explain to them what a neuroendocrine tumor is, because you never know if that person next to you, you're going to save their lives. Robert and I had a fundraiser out east on Long Island, and it was at a winery. And we were totally shocked because for years, Robert and I have been working really hard on this, and I thought we were doing a great job in our neighborhood. And we're at the event, and we had over 100 people at the event, and 4 people happened to be at the winery doing wine tasting, had no idea that this fundraiser was going on, and they had lost 4 loved ones to this disease. And they were like, "We never heard of you. We didn't know anything about you." I've met people in the store who have seen my bracelet, or Trisha happens to have a tattoo on her foot, and somebody will say, "Oh, wow, what's that ribbon about?" You never know if somebody's going to ask that question and say, "Oh, I know somebody with this disease." Actually, there's somebody here that happens to have a brother whose father-in-law has the disease, and they've been working in this field a long time, and they didn't even know that the father-in-law had it. So you never know if somebody out there has this disease, and you're going to be the one that saves their lives by just wearing a pin and bracelet. It doesn't seem like much, but it does change people's lives. So just take that minute to do that.
Another thing I'd like to bring up is how many celebrities that we've had that have had this disease, and I don't know if you guys know it, but Audrey Hepburn was one. She had appendicitis, yeah. And I know you know about Steve Jobs. He had a pancreatic neuroendocrine. And honestly, I'm just going to talk about that situation for a minute. Again, this is personal to me, so I get to say what I want. I was standing in my kitchen when I heard that he had died from what I have, and it just sent shockwaves through me. If Steve Jobs, with all his money, connections, and everything, passed away, I don't have a shot. I was newly diagnosed. I was horrified that Steve Jobs had passed from this. From what I personally have found out in my little personal world, see all that, covering my career here, he went a different way. And that's his choice, and we all have very important choices to make in this arena, and what we're going to do with our care for the next step. At any rate, that no longer scares me because I have made different choices. And we also have Dave Thomas, who's another one, founder of Wendy's. And so, we're not alone by a long shot, but I wish that some of these people, for example, from what I understand, like the Jobs family is huge. Can you imagine if they came out and stood up for what had happened, how that could really be, wonderful for our group and to get the word out. So that's just kind of what I wanted to tell you, to not be afraid of some of the things you hear out there regarding it. The other thing is, like she was saying, that thank God, if I was going to have this, I was diagnosed at this time in the process. I'm 7 years out, but look at what these wonderful doctors have showed us today of everything coming down the road for us, and that's just, it's just hang in there, and these things will come up for us. As far as the misdiagnosing goes, I was misdiagnosed for almost 15 years with irritable bowel Crohn's. They told me to go see a psychiatrist because I was having panic attacks. And these panic attacks would be coming like when I was writing a check at the grocery store, and all of a sudden I thought I was going to pass out and have this panic attack. I haven't had one panic attack since my surgery. So it's amazing how that, cured the panic attack as well. But anyway, we're also going to be taking questions and stuff. So go ahead and think about that. She's going to talk a little bit more, okay?
I just wanted to just cover a little bit about, being your own advocate. I know Marianne just gave a great talk on that, but I just wanted to expand on that a little bit. And we talked to some people, around today. Even though we're nurses, I can tell you, when I go into the doctor, I immediately go into patient mode. So sometimes, I have to go in there armed with my questions. They're written down ahead of time. I always make sure I ask for copies of things. I keep records of everything. And I have become the general contractor of my life. No one is going to care about you as much as you. No one's going to know everything about you. And as Marianne said, this disease is very different for each of us. No two of us are alike. So you can't even assume that your doctor's going to even know what questions to ask you. So if you go in and, you're experiencing, headaches or, ankle pain, whatever, even if you don't think it's related to your disease, mention it. It's always good to communicate those things to your doctors so that they can sort of get the whole picture. I think the longer we all live with this disease, I think that there'll be more and more information out there. These doctors will be more and more aware of how this disease progresses and, some of the other things that we'll experience. And that's why I think it's very important to, communicate all that information all the time. I just want to say one thing because this came up in the audience. For those that are newly diagnosed or for those that aren't, there's a lot of information on the website and things like that. But one of the things that's important is not to take epinephrine. Okay, and I didn't hear that mentioned today, and that's usually something that's a walk-away message. And a lot of the doctors won't communicate that either. Some of them don't even realize it. For those that don't know what I'm talking about, epinephrine is it's actually found in it's an adrenaline type of substance, and it's found in it's added very often to things like lidocaine. Okay, which is a numbing agent, or Novocaine. Right. So basically you get those medications when you go to the dentist or you're going to the dermatologist and they're going to inject your skin to take off a mole or something like that. And it's not recommended for people with neuroendocrine carcinoid because it can cause a carcinoid crisis. You can experience, a lot of numbing and tingling, but it can go further than that. It can raise your blood pressure. You can have issues with it. So it's an important thing to communicate to any doctor you go to that it's not recommended that you have epinephrine.
Yeah, that's very, very important because you don't want to go into a carcinoid crisis because, believe me, I have. Also, another thing is that if you're seeing a surgeon and you're having surgery, it's also recommended that you get, most cases, pre-medicated with octreotide, and that's something that you really need to ask your doctor and speak to the surgeon about. I had an episode where I was having a non-abrasive but kind of abrasive test, and I had said to the doctor, I need to have an octreotide drip, and he said, don't worry about it, you'll be fine, I do this all the time. And I said, no, I really need an octreotide drip. He said, oh, we'll give you an injection of octreotide, you'll be fine. So Robert was with me, and we had extra little vials with us, and he said to the doctor, here, take these vials into the operating room with you, just in case of an emergency. And the doctor said, oh, don't be silly, gave them back to Robert. Well, they went to go put me under, and they went to flip me over, and I aspirated, and I went into a full-blown carcinoid crisis and flatlined. The nurse, or the anesthesiologist, ran out of the room and found Robert and said, where are those little things that you had? And Robert said, what are you talking about? I need those things for your wife. Quick, quick, quick. So Robert gives it to them, and they brought me back with the octreotide. Had Robert not had that, and we had waited for the emergency room to the pharmacy to bring it up, I might not be here today. So I always make sure that you speak to your doctor and ask them, am I a candidate to go into a carcinoid crisis, and are you going to pre-medicate me beforehand? If you're not going to pre-medicate me beforehand, make sure that it's in the room. And if they're not going to put it in the room or pre-medicate you ahead of time, do not have the surgery if you are a carcinoid syndrome patient, because that can be life-threatening disease.
And again, we're not, can you hear me? We're not saying all this to scare you. We're saying this because knowledge is power. You go out there and you tell your doctors, no, I'm not having that until these files are there. And if they don't know, that's your little time to maybe explain to them, why and what's going on. And then, always you can have them call your other doctor or whatever. Just stand up for yourselves. Be your own advocates. Along with when she told you to go back and get all the papers and lab results and all that, what I did is I actually have a notebook, and I've been accused by a physician of being a professional patient, which I take as a compliment now. And so what I did is I took a notebook and I have labs, scans, reports and whatnot, and I have them in chronological order. And then they're all there. So I have my chart with me all the time. If I go to a different doctor's office, it saves time them saying, "Oh, you had a CAT scan? Yeah. Oh, well, I'll have to get the report." No, just a minute. Here it is. Right in your visit. It saves time for them having to get their staff to call that staff to have it faxed back, etc. So that's just a good thing. Another note is when you have a scan done, ask for a disc. And keep one in your possession, and then, of course, you can ask for another one at any time to send on if another doctor wants it. But ask for one at least to keep in your possession so that you'll have that.
I was just going to say, we can use our smartphone technology now because even if, you're at the doctor's office and they don't have time to copy anything or whatever, you can just, use your phone. Take a picture as much as you can of anything and everything you can. And also in your phone, under health, if most of us have iPhones, I would assume, under the health section, you can put all your information, including norepinephrine, what your diagnosis is, who your doctors are, et cetera, et cetera. And that's important because, God forbid, a car accident or any other type of emergency, all your information is in there. But it's also good for you when you go to the doctor and you have to list your meds and any tests that you've had, you can have that right there in your phone in case you forget that huge book that I have too. So that helps as well.
Maria, do you have the microphone back there?
Maria.
Maria,
she's got one.
Does anybody have any questions or statements or?
Throw them out there.
She's coming with the microphone. There's the microphone.
I was diagnosed in 07, and in 08 I had right liver resection and part of the small intestine removed. And I was good. All scans, blood work, good up until just this end of this past year. CT scan was good. Blood work, CGA was elevated. So I had octreotide scan. It showed a lesion in the liver that has reoccurred. But back this past May, back before we realized that it had come back again, I had to have a pacemaker put in that supposedly is unrelated to this. Supposedly. I was just walking, getting my exercise one day, and my heart rate I didn't know what happened, though. I didn't know what it was, but I knew I didn't feel right, and I just kind of took myself down to the ground. We had to get the ambulance. Anyway, my heart rate was dropping to 30, and it was doing it in the ER. And they called a cardiologist in, and they did tests through the night and determined the next day I needed a pacemaker. Well, this was before that we found that the cancer had reoccurred. But fortunately, the doctor said, we are putting in an MRI-compatible pacemaker, knowing your history, in case you need to ever have another MRI. Well, who was to know that I would need another MRI very, very soon?
Were you on Sandostatin during that time?
No, I've never been on anything like that.
That's an issue.
Right. So another thing that is really, really important, and a lot of doctors don't sometimes tell you about, is that every one of us need to have an echocardiogram every year.
Mm-hmm.
Because if your tumors secrete serotonin, you can be damaging your valves.
Well, I even questioned, although for 9 years nothing had reoccurred, I was fine.
No,
but could that tumor have been secreting something?
Yes, that's me. That's me.
That could have affected, but they tell me that the problem with the heart is that it affects your valves.
But it can, because high levels of serotonin, and for years ago when we were first diagnosed, if there was no active tumor, they didn't put you on Sandostatin.
No.
It wasn't until you were either symptomatic or they actually saw something. Nowadays, if you're diagnosed, you really should be on Sandostatin almost immediately. That is the general rule of thumb. And the reason for that is because not everybody secretes every single moment of every day. Some people are cyclical secretors. Some people secrete more. The tumors are more active when there's stress and activity. Some of us have little tiny like pebbles or sand particles of metastasis. I myself don't show on any visible tumor, but my markers are high and very symptomatic. So I've been on Sandostatin now, and I'm actually on Sando and Lamreotide. But the answer to your thing is that yes, because it is related. It's absolutely related. And are you on Sandostatin now?
No.
Okay, 100%. You need to be on some type
So
of
they
medication.
want to wait 6 months because the little
Okay.
place in the liver, the lesion is so tiny.
No, you need to
I need to
be
be
on an octreotide, okay? You need to be on an octreotide. Absolutely. If you have tumor, you need to be on octreotide of some sort. And if you've had a tumor and they took it out and there was any metastasis, you need to be on octreotide. 100%.
Okay.
Okay, and you need to have your levels monitored, and you also, one of the other things the doctors mentioned was pancreastatin. That is a big marker because it's a more pure marker. And the recommended lab for that is ISI. So if there's any questions on that.
One of the things I do want to bring up is everybody's talking about the high serotonin levels, but if you're a PNET patient, we actually have low. So I see some confused faces out there. You're like, what? Yeah. No, that's okay. Just to clarify that, that's just how it goes. With PNET, we're low, and with the carcinoid and the other ones, they're high. So.
And like I said, each one of us is different, so you have to find out what marker is yours.
Different zebra.
Yes. My tumors happen to secrete histamines, and for 4 years, I was tearing myself apart at night, scratching. I was scratching so bad that my legs were black and blue, my stomach was black and blue, I had like claw marks on my stomach. And I kept on taking Benadryl. The doctors kept on saying, take Benadryl, take Benadryl. I was taking Benadryl, nothing was helping. And finally, I went to a specialist and I said, you know what? I can deal with going to the bathroom 40 times a day. I can deal with the flushing. But one thing I cannot deal with is this itchy all the time. It's just driving me nuts. And he said, well, has anybody ever said to you, try an H2 blocker like a Zantac? And I was like, why would I take an antacid? And he said, because a Benadryl is an H1 blocker and the Zantac is an H2 blocker. Well, now it's been 12 years since I've started it, and if I miss a dose of my H2 blocker, I will wake up in the morning with black and blues across my stomach or my legs from scratching. So, like they said, each one of us is different, so you need to find out what your markers are, what your symptoms are, what that is, and keep track of that with your doctor.
Just by a show of hands, is there anybody in here, we're not going to name any doctors' names, who's a little bit iffy about their doctor or not so happy with their doctor? Yeah. That's your little red flag and tap on the shoulder to maybe go find somebody else who has whatever you're missing, find a different doctor and stuff. The doctor that I went to the first time was a family friend. The one who told me I was 100% cured, and he even had a caveat, if I wasn't your family friend, I couldn't tell you this because whatever. And so, okay. So I really believed him. And then when I started questioning him after I had a visit with Marianne and everything, he didn't care for that questioning very much. And he said, look, your cancer is only 1% maybe of all cancers. And that was supposed to satisfy me when in fact I thought, okay, then I need to find the doctor who is 1% very knowledgeable about my cancer. And so you need to be proactive. And I knew hands would go up. So, seek out a different physician, who can help you.
And just because they're an expert does not mean that they're a perfect fit for you. Okay? So what you need to do is you need to find somebody that you're comfortable with, that you trust, and don't let anybody on the internet, on Facebook, shame you into going to one of their doctors. It is a personal choice of what doctor to go to, okay? You have to feel comfortable. If you're not comfortable with your doctor, you're not going to do well because you're always worrying, is the doctor making the right decision, which is only putting more stress on you, which is making you produce more serotonin, which is doing more doubt. So if you have that little doubt, just go and get another opinion. Hey, listen, if I had listened to my first doctor, I wouldn't be here. If I didn't listen to my second doctor, my seventh doctor, I have seen 5 of the specialists in the world. If I had listened to the first doctor, I wouldn't be here. So you need to find one that you are comfortable with, that is knowledgeable, and even if they're not 100% knowledgeable about the disease, will they be willing to work with the specialist? You don't have to go to a specialist every time. It's not like, say, if you want to go see a specialist in Iowa or something. You go there once, and they'll work with the local doctor. Or if you want to go to Louisiana, or you want to go to Mount Sinai, or you want to go to Montecor, you can go anywhere you want to see a specialist, and you only have to go there once, and then they can communicate with your local doctor. And that's another thing. If a doctor doesn't want you to go get a second opinion, that's a red flag to get the hell out of there. Because most doctors will feel comfortable enough about it that they will let you go to another doctor.
The second doctor I went to, and that's when I knew I was with a good doctor, and he said to me, Rhonda, I don't mind speaking to anybody in the country on your behalf, and I'll just be like the quarterback. So he sent me up to a couple specialists, world-renowned guys, and they have conversations regarding my care, and then, they just do it, in conjunction with each other. And that's how a lot of us are handled now.
And I was just going to say that, as the other doctors mentioned, having a team approach, having doctors, like Marianne said, we need to see a cardiologist once a year, for females and males, you need to have your prostate checked, or pap smears and breast exams. Those things are important. And it's going to sound very overwhelming, like, oh my God, I'm going to be at doctors all the time. And it's not. I always tell people, and I joke, but, you get a haircut every 6 weeks. You get your nails done. It's like, you just add a doctor in there too. And it just becomes a way of life, because the most important thing and the key word is that you're living with this disease. It is not a disease that, at this point is curable, but it's livable. And that's the most important thing. And that you just incorporate it into your life. It doesn't have to be your whole life. And that you take some control, and and that you make sure that you do that communication to the doctors.
We're just kind of, I know I can see what we're doing. We're just, as things come to our minds, we're just popping it out at you. One of the important things that I believe is the mind, body, spirit connection. To me, that's the whole person. And just by a show of hands, how many of you dealt with anxiety or depression after your diagnosis? Okay. Completely normal. It's completely normal. There's nothing wrong with you. I say normal is only a setting on the dishwasher. Otherwise, if you get anxiety stuff, don't be afraid to go talk to somebody. I know in my area they have an oncological psychologist who only deals with oncology patients, obviously. But don't be afraid to go talk to somebody. It's not good for you to be all uptight and not sleeping or whatever your anxiety level is, or it causes depression or whatever. And don't be afraid to get on antidepressants if that's what they say. I mean, this is not a willful thing. This is a physical, chemical thing going on. And the same with the depression. You just accept it and baby yourself.
And
also, when you're talking about your body and your spirit, when you're eating, you look at that list of things that you're supposed to avoid. Just remember, this is a disease that you're going to live with a really long time. And if you want that chocolate cake, eat that chocolate cake. Don't deprive yourself from it. Yes, you may pay for it and be in the bathroom for a little while, but sometimes that's good for you because, sometimes it's good for you because it makes you happy for having it. So, I hear people saying all the time, oh, I can't eat this, oh, I can't eat that, oh, I would die for a slice of pizza, but I can't eat the tomato. Eat it once in a while. I'm not saying go and eat a whole pizza pie. I'm saying have a slice. Don't deprive yourself. You're going to live 16 years. You don't want to deprive yourself for 16 years of being miserable because you can't eat anything. So, if it makes you that sick, then avoid it. But if it makes you a little uncomfortable, sometimes it's worth it.
Absolutely, man. That chocolate cake's talking to you. I'll pay later.
Again, that's an individual thing.
That's an individual thing. For instance, I cannot eat turkey.
Yeah, I can't either.
I can't eat turkey, and I think we have the same genes.
Yeah.
I cannot eat turkey. For 2 years in a row, I ended up in the ER.
Yeah.
And they told me that I was having kidney stones. It wasn't until after my diagnosis that we found out that I was actually having a carcinoid crisis.
Because of the tryptophan.
Because the tryptophan turns into serotonin, which was...
I was sick on Thanksgiving for 5 years in a row, and because I would have wine, and I would have turkey, and I was violently ill for 5 Thanksgivings in a row until we figured it out.
It was really funny because for many years I was very close to Dr. Warner and his wife before she passed away, and they would call us every Thanksgiving to wish us happy Thanksgiving. And I said to Dr. Warner one time, I said, I'm really dreading today. And he said, why, Marianne? And I said, I'm going to have turkey and I'm going to be sick as a dog again. And he said, oh, don't be ridiculous. Turkey is fine for carcinoid patients. And I said, no, when I eat turkey, I end up in the ER. And he said, no. And I said, yes. So, each one of us is different. So I can eat turkey.
I was just going to say some of it, sometimes it's a mechanical thing. Like I've had a small bowel resection and things like that. So there are things I cannot digest. And then, or, your body doesn't tolerate. Also, if you've had your gallbladder out, sometimes things affect you as well. Most of us have or will have their gallbladder out. So, it's little things like that. And a lot of it's you just kind of learn, I think, through the years of, what you can tolerate and what you can't. But, I think the most important thing is quality of life. And I think that, that's a very individual thing. And I think everybody has to make that decision. When I was first diagnosed, there was somebody, a person also diagnosed who made an absolute decision to go on one of those macrobiotic diets, and that was fine for them. There was no way I could have lived like that. But you know what? That was a personal choice. So I think what you decide to do for you is your decision.
One quick other point that I completely forgot, but when you're going into your doctor's office, and Judy was talking about the pains and stuff like that, I probably could have gotten diagnosed a little bit earlier had I told the doctor everything. You have a tendency not to tell the doctor everything. They'll say to you, are you having diarrhea? And you'll say, no, I'm fine. But you don't mention that 2 weeks ago you were in the bathroom 30 times or anything like that. So it's a really good idea that if you're having a really bad day, maybe keep track. So when you go to the doctor and they say, how the bowel movements or how you've been feeling, how many flushing episodes have you had, if you have some kind of record, then you could tell them, because we have a tendency of not telling them everything.
One of the other things, like I said, was kind of free flow thinking up here, is about multivitamins and any other kind of herbal stuff that you might be taking. Please run that by your doctors. One of the things that I was taking was turmeric. I heard, oh, that's wonderful for you. Well, at the same time, I was on some radiation, and a specialist up at UPenn told me, stop that right now, because that has something to do with lowering the effectiveness of the radiation. Who would have thought that? So run everything you're taking by your doctor, vitamins, whatever, anything holistic. And these doctors are so smart. They just hear patients talk and they throw out the garbage. Okay, that's not important. That's not important. Oh, she just said something it is. So just let them decide what's garbage. Questions?
You have the microphone?
Go ahead.
Yes. Is it important to use ISI for all tumor marker labs or a few? Because I use CPL and Quest and others. How important is that?
I can answer that. Most labs are okay at your when you go to your local doctor and they do those labs. The reason I mentioned ISI on the pancreastatin is because there's 2 other labs that they'll send that out to. Hospitals will contract with labs to send out, and I'm speaking as a patient. What happens is some of these tests are highly specialized, and pancreastatin happens to be one of them. Serotonin and some of the other tests are perfectly fine being done at the local lab. Okay, so you'll go into either your hospital or you'll go into Quest or LabCorp or something, but they will contract with the lab who actually processes it, and it's Cambridge, Mayo, there's several of them. But the reason I mentioned ISI is because pancreastatin recently, for a lot of people that have had it just through some of the other labs, the levels have not been accurate, and they've been, or they're not getting them back because they're having trouble at the lab level. ISI has been doing this. It's a very highly specialized test, and you can contact them, on the web, or you can ask your doctor to request that it be sent out there. That's specifically to pancreastatin. That's why I mentioned it. Okay.
Question?
I have 2. To Judy, I thought you mentioned that you're on lanreotide and sandostatin. Is that sandostatin PRN, or is it?
Yeah, no, I'm actually, and I'm glad that to address that, because I think there was a question: can you take lanreotide and sandostatin?
Oh, yeah.
So I'm on lanreotide, the long-acting, and right now, in particular with my case, I'm having trouble. I'm very symptomatic, and we're having trouble with my levels. They're continuing to rise, but no visible tumor. So we have to assume it's just all these little poppy seeds that are acting up. So we're trying to get those things under control. So I'm eventually going to be on the pump. That's the goal. But right now, I'm taking the lanreotide. The sandostatin, I was taking what they call a rescue shot. I was giving it to myself subcutaneously. But I'm now actually doing it routinely every 8 hours. Whether or not I feel like I need it or not, only because I'm working with my oncologist and my specialist. We're trying to get myself at a blood level. So there are different times that you'll do different things.
Right. I was on sandostatin for many, many years, and several years ago I switched. So I am now on an insulin pump filled with octreotide 24/7. And that's how I respond, because my body metabolizes the sandostatin so much. For 8 years, I was on 4 injections a month. I was on 4 30-milligram injections a month. And I did that for over 8 years. And it became such a problem because you're only allowed to give it in a certain spot, that I had so much scar tissue there that literally when they went to go to the injection in, the needle would bounce off. So I had no choice. But I do have better control with the octreotide. That right now I'm probably at 60 milligrams of sandostatin versus with the octreotide pump versus me having the injections myself.
You had another question?
I have one more question about the bank that you're going to have with the tissue samples and with the blood tests. Someone told me that after, at least I think the hospital where I had my surgery, after about 12 years, they do away with the tissue samples.
Right.
Do you still want our blood work if we don't have tissue samples?
Yes, they'll want the blood work as well.
Even if we don't have the tissue
Right.
samples. Okay. Thank you.
Thank you.
Anybody else?
Let's just bring the mic.
We hear time and time again, always be sure that you see a NET specialist. In looking at the Cancer Foundation listing for that, there's not a whole lot listed, and it doesn't seem like any's been added in a long time. Can you recommend where there is a listing for that, or recommendations?
So years ago, the Carcinoid Cancer Foundation used to have a criteria of how you were listed on there. Several years ago, they changed it where anybody could put a doctor that they worked with. There are several doctors in the area that do treat NET patients, and we'll work with local doctors. So give me a call, and I will try to find somebody for you that'll be a match. I'll give you a couple of names. But, I try not to recommend, I try to recommend a doctor that I know treats the patients. I know that they have a good relationship and have good results, rather than just taking somebody off the internet.
And I was going to say, this is where your local support groups come in as well, because, you do a lot of networking, and you communicate with each other, the local guys, and women in the area that, perhaps are treating. And when you do see a doctor, the first question you should ask them is, how many neuroendocrine patients do they have?
And are you willing to work with somebody out of state?
Any other questions?
Okay, so we're going to wrap up.